The shift that needed to occur was that we needed to have access to services on the island.
You're listening to Community Health Stories. On today's short episode, you'll hear part 3 of the story from Dyan Dunsmoor-Farley, telling us how life has changed for Gabriola Islanders since the formation of the Mental Health and Substance Use Action Team.
So the community really came together around the issue of mental health, and I think one of the really important things that the working group decided to do was to tackle this in a collaborative way. So we reached out to Island Health, that's the local health authority, and engaged them right from the get-go, not as adversaries and not as people demanding things, but as people exploring what the challenges were. When we were dealing with the issue, we were dealing with it as partners at the table. And it also meant that we had to do some work in order to demonstrate to Island Health what the nature of the issue was and what the service needs would be. The shift that needed to occur was that we needed to have access to services on the island. Over time, we were able to demonstrate to them that there was actually many efficiencies to be gained by putting resources on Gabriola. So, initially when they started providing services to us, they provided a mental health nurse to us here on the island, but it was a Nanaimo-based mental health nurse, and we went through, I think, 3 nurses in just over a year before it became abundantly clear that none of the Nanaimo-based staff wanted to be stuck sitting in a ferry lineup, going to work, and then missing the ferry going home from work, which added hours onto their day. So it was at that point where the light kind of went on that there was some important resources that should be here. So the mental health nurse was added to the team, billed by a professional from Gabriola. A social worker was added. We'd never had a funded social worker before. And both these positions started off part-time, but as we were able to demonstrate over time, the need was great. And so they've evolved to almost full-time positions. It's had an immense impact on the community. One of the things that's happened is that we have a network of care now that is based here, that understands the context of living in a small community, knows where all the resources are, and these staff are known by people in the community. So they're seen as islanders. They're trusted. Oh my goodness, I guess we're going into our 5th year of a very, very successful model. This has been an amazing ride. The community's stronger for it. We are getting great results. Our partnership with Island Health is amazing. All those things. And I never really thought about, well, why is that the case? Like many of us just take action. We do. No person has the authority to care.
This has been Community Health Stories. For part 1 and 2 of Dyan's story, visit our website, bcachc.org. And for more information about community health centres in Canada, visit cachc.ca.